Hi, my name is Nellis Piorojas. I'm here today to talk about OTC, over-the-counter prescription drugs. This is my audience right here. There's only one or two.
Hello?
No more.
No.
But anyways, I'll try to do my best. Just a sec. As I said before, I'm here to talk to you about OTC. What is OTC? OTC is over-the-counter drugs. Those are the type of medications that you can buy at any pharmacy, convenience store, grocery store without any prescription. The most common OTC drugs are pain relievers, cold and cough medications. Those type of medicines, they're actually very effective, right? But they can be very dangerous and lethal if they are taken or combined with another drug. I am going to give you an example, share a story of mine, which is not exactly I combine it with another drug, but why did I take the pill with it? I was actually being treated for malaria. Actually, I was living in Angola, which is in Africa, and over there you don't need a prescription from a doctor to buy a medicine for malaria. It's like the flu over here and here in the States. So it's like an OTC drug. You don't need a prescription at all. So my mom was away on vacation and my dad was taking care of me. I was eating my breakfast. So he told me, you know what, don't forget to take your pill. I was about 8 or 9 years old. I can't remember exactly my age. So I just took the pill with my milk. I drank it, took it, and I remember being like sick on my stomach like a half an hour later. And I remember feeling with such a pain, trying to wanted to vomit and feeling awful. But that's why because I took with milk, and that's the combination. It didn't work for me. It might work for some people, but who knows. I also heard that if you take a pill with Coke, because it contains Coca-Cola contains caffeine, so it might actually make you high. So the reason why I'm talking about OTC is just because they are easy to get. That doesn't mean that they always work or they're always safe. The best treatment for a cold is still plenty of rest or liquids. Not I'm here to talk to you about or how you should treat your cold or flu, but it's what I'm trying to explain. My point is never combine any drug, even for the most harmless ones, or let's say any OTC drugs with other drug. Let's say I'll give you the most common abuse over the counter is the cold syrups, and most of them contain DXM, which is an antitussive or cough suppressant drug. It's one of the active ingredients used to prevent coughs. So in many of the counter cold and cough medicines, you can find them, such as in Robitussin, NyQuil, Vicks 44, among others. The thing is, what it contains, when you combine with another, let's say an anxiety drug or antidepressant, that can be dangerous. And according to FDA, most of the recent visits to the emergency room might be for OTC poison or overdose of TC, because people, or mostly among teenagers from 15 to 16 years old, they're taking this type of drugs to get high, which is that's the way of they finding an easy drug to get it, to have access with, to get access without having any illegal action to it. So I advise to be very careful when taking medicine or combining other medicines, and I'll also give you some examples of people that are actually abusing the XCM, some of the symptoms that you might find there, like being high or drunk, looking like drunk without the odor of marijuana, occasionally the odor of cherry flavor, that's cough syrup, red eyes, dilated pupils, also sweating, rapid heartbeat. That sometimes be sign that can be actually signs of abuse of cough syrups, which is or DXM. So I recommend people, and if you want to be safe, just read the label, do exactly what it says. It's better to be safe than sorry. Thank you.